And thank you for joining us. On today's briefing, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, and Darren Rausch, Health Officer and Director with the Greenfield Health Department. Mayor Barrett, I'll hand it over to you to get it started.
Well, thank you very much, Catherine, and good afternoon, everyone. I'm pleased. Let's start with some good news. I'm pleased to share that we have received 2,000 doses of Johnson & Johnson vaccine, and next week we will use that at multiple shelters. This is a big focus of our community vaccination efforts coming up, and so we're pleased to have that. This is obviously attractive for those at the shelters because we have some concerns just to make sure that they're getting the full vaccination. And if it's 2 vaccines, it gets a little bit more challenging. But that's a place where we think that we can have a lot of very positive impact throughout the community. For the last year, and it really was a year ago, basically right now, I think many of us, as we fought through this incredibly challenging year, from the pandemic to the economic tsunami to the fight for racial justice, have been thinking, when's the cavalry coming? When's the cavalry coming? When's the cavalry coming? Well, I'm pleased to announce that the cavalry has arrived in the form of the Federal American Rescue Plan, which is really a historic document. And I'm very, very thankful that President Biden led the charge on this. And I'm very, very pleased that he has now, just in the last hour or two, signed it into law. So what does it mean for the people of Milwaukee? We know that those people who were most disproportionately impacted by the pandemic and by the economic tsunami were those individuals who basically were at the lower end of the economic scale, the people whose jobs were interfacing with the public, whether they're working in grocery stores or working on our buses or you name it, the people that went to work, many of whom unfortunately ended up losing their jobs. We know that there were millions of people throughout this country that lost their jobs or saw their jobs dramatically decreased in terms of the number of hours they worked. So for clearly, I think the most immediate impact is going to be the $1,400 per person check for those individuals who are eligible for the check. I think that's going to be a huge impact. I think certainly the extension of the unemployment compensation is going to be important for those individuals who have been affected by this in the long term. But there are other provisions that I think really go to many of the underlying causes of the healthcare disparities that we saw laid bare because of this pandemic, and specifically things like the child credit. I think that making that refundable is going to have an impact for particularly mothers at the lower end of the economic scale, and I think that that's very, very important. The changes to the Affordable Care Act, making that more affordable and accessible to individuals, I think is very, very, very huge. The Earned Income Tax Credit, again, a very, very powerful anti-poverty tool that rewards work. And I think that is very, very huge. For local governments, it means a lot. And I know the county executive feels the same way. We're extremely thankful. We saw a loss of revenue of tens of millions of dollars, from parking structures to library fines to to permit fees and things like that. And we took some hits. And I think it's going to have an impact because even though our tax revenue is largely driven by the property tax, it has in some parts of the city had a negative impact on the property values. And so all of that means that we have got a challenge over the next few years with the infusion of new dollars. With new dollars comes new challenges. And what I've said is that we're going to spend this money wisely. We're going to spend it prudently and try to deal with some of the most pressing issues, ranging from housing to lead paint, to the lead laterals, to other healthcare disparities that are out there. There are dollars in this bill for small business, and I think the president has made it clear that in the first round, a lot of big businesses benefited from this, and now it's time to make sure that the small businesses benefit from that as well. That was something that we tried very, very hard to do with the allocation that we had received earlier, and we're going to continue to do that. So I'll be working with the community, I'll be working with the council to make sure that we're using these dollars prudently. So it has been 1 year, and today also marks the 1 year anniversary of when the World Health Organization declared the global pandemic. And I think it's a good time to pause and recognize and thank everyone who has contributed to the effort to fight the COVID-19 virus this past year. As difficult a year as it has been, and it has been a immensely difficult year. It is also gives us an opportunity to pause, take stock, and really be thankful for our partnerships. For example, our partnership with the county, our partnership with the state, the hard work of city employees like the Milwaukee Health Department, who has worked tirelessly on testing, on vaccinations, on mask distribution and safety guidelines, among many other roles. Our Department of City Development, I mentioned this earlier, for providing over $18.5 million to over 1,000 local businesses through its Restart Grant program, utilizing the Federal CARES Act dollars. Our Department of Public Works for continuing to provide essential services and really being flexible. As you recall, they took some quick action with our active streets, which allowed more and more restaurants to continue to serve people and use more of the sidewalk and sometimes some parking spots as well. That allowed us to expand outdoor seating for local businesses, even through the coldest winter months. Our election commission, we all remember last April when we had the election in really the midst of the first pandemic surge, but they've ensured that all residents have access to safe voting options. The library for continuing to offer services virtually through contactless pickup and in person, as well as offering staff to work as contact tracers and poll workers when needed. They really have stepped up as utility players in some other departments. So as a reminder, I will be highlighting these stories, the photos and tributes to individuals and organizations in the community who have gone above and beyond in their response to the pandemic on my Facebook and Twitter pages beginning on Saturday, which is the 1-year anniversary of COVID-19 in Milwaukee. We really do want to shine a spotlight on our neighbors, our colleagues, our friends, family members, and community workers who have helped our city fight the COVID-19 pandemic. So again, please share your tributes using hashtag honoring MKE heroes on social media. And if you're sharing from a private account, make sure your post is set to public so we can share the good news throughout the community. Finally, we continue to fight the fight. Testing continues to go on. Yesterday at American Family Field, we had 511 people tested. We had a total of 147 people tested at the Northwest and Southside Health Centers. So the testing is down, but as Dr. Weston will tell you, the numbers continue to trend in a good direction. We're not out of the woods yet, and we continue to have some serious disparities, particularly when it comes to vaccinations in some of the areas of the city. And that's something that we're continuing to work on to try to see how we can bring the vaccinations to those neighborhoods that are disproportionately impacted. So there'll be more news on that. But please continue to seek testing if you're experiencing symptoms or if you think you've been exposed to someone who has tested positive for COVID-19. So with that, I'm going to turn it over to County Executive David Crowley.
Well, thank you so much, Mayor Barrett. And as Mayor Barrett just acknowledged, today and the next few days are important dates to reflect on as a nation, as our nation has really been battling the coronavirus for a year now. So on March 12th, 2020, the first case of COVID-19 was reported in Milwaukee County. And on March 19th, we had our first COVID-related death. And over the past year, this pandemic has taken a toll on our community. I want to acknowledge all the lives lost and the families mourning the loved ones as this virus has ravaged throughout our country. And I want to thank our frontline workers who continue to show up for work every day, providing essential services to our residents, including medical care, mental health resources, transportation, housing support, and more. These programs and services are essential to our county's infrastructure and serve our most vulnerable communities. And throughout this pandemic, data has shown that the magnitude and impact of COVID-19 is not universal. The dramatic disparities highlighted by the pandemic further uncovered deep racial inequities that have existed in government systems for generations. And we've seen two destructive coinciding forces cripple our country and our county. And these are structural racism and COVID-19. But now more than ever, it's crucial that we face both of these public health crises to achieve health and racial equity across the county. And as the vaccine continues to roll out, we hope you'll choose to get this shot when it is your turn. And we all want to get back to spending time with our people that we love and doing things that we've missed all last year. And the vaccine will help us get there. Next, I want to discuss the federal COVID-19 relief bill that was just signed by President Biden And while we don't know every detail about the relief package and how it will be distributed, Milwaukee County expects to receive $183 million in federal funding, which will allow us to respond to the public health emergency, mitigate the spread of COVID-19, and invest in vaccine distribution. And this critical funding will help address the direct impacts of COVID, but it does not address or alleviate the significant structural issues that we are facing. The federal relief bill helps us put out the fire, but it does not fix our foundation. And we look forward to sharing more information about the funds Milwaukee County will receive from the American Rescue Plan. But I want to emphasize that we still need additional tools like a local option sales tax to fix the structural challenges that our county is currently facing. And I would like to remind everyone of the current efforts to continuing vaccinating the Native American community here in Milwaukee. The Gerald L. Ignis Indian Health Center is teaming up with the Wisconsin Department of Health Services to distribute the COVID-19 vaccine to any enrolled tribal member or descendant in Milwaukee County that is older than 18. This is the last day to take advantage of this event, and the center closes today at 4 p.m. So if you are eligible, go to the Gerald L. Ignis Indian Health Center website, or you can call 414-316-3737 to make an appointment. And lastly, with St. Patrick's Day coming up, I want to encourage everyone to stay safe while enjoying the holiday. We know that this is a big event for many people in our community and a way to have fun amidst these difficult times. So whether you're supporting our local businesses in person or ordering food to go, please be safe. And please remember that the pandemic is not over, and we must remain vigilant in our individual efforts to keep our loved ones and ourselves safe. And with that, I'd like to hand it over to Dr. Weston. Dr. Weston.
Thank you, Mr. County Executive. Good afternoon. First to our numbers, and I want to modify how I report this out a bit to reflect the progress that we've made as a community since this all began a year ago. So right now, we are currently seeing an average of 70 new cases a day of COVID-19 and are now down to about 1 death every 2 days. This is incredible progress from our peak just a few months ago of over 1,000 cases per day and about 9 deaths each day. We continue to also see promising low numbers of cases and hospitalizations as well as deaths. And we've had over 225,000 doses of vaccine administered to over 160,000 individuals in Milwaukee County. 160,000 people is a lot. It's 17% of our county. But we can do better than that, and we must do better to achieve the herd immunity we need to ensure that we have no more spikes, no more packed hospitals, and ultimately, no more deaths. We can do better, and we must do better. The state is providing us with a gradually increasing supply of vaccine, and we're so grateful to see our numbers increasing. We're now vaccinating nearly 6,000 people a day in Milwaukee County, a 30% increase from just a week ago. And for our part, we continue to expand vaccination sites and access opportunities. The Wisconsin Center continues to expand their services, and the Milwaukee Health Department is further developing their community outreach with more localized clinics, particularly in the most vulnerable parts of the city. The health departments in the southeast region of the county have opened the South Shore Vaccination Clinic site in Cudahy and are expanding services there. In the other health departments, the health systems and the federally qualified health centers continue to expand their outreach as well as their capacity. And at the Milwaukee County Office of Emergency Management, we continue to expand our operations at Kosciuszko Community Center at 7th and Beecher on the south side of the city. At that site in particular, anyone who's state eligible and lives or works in 53204, 53205, or 53206 can register for vaccination at covidmke.com. So state eligible, lives or works, 53204, 05, or 06, register at covidmke.com. We're encouraged to see the eligibility from the state expanding. The more people we can get vaccinated, the better our community will do. While we wait for that March 29th date to come around, it's so crucial to remember who may be eligible now and not know it. Bus drivers, childcare workers, grocery store, convenience store, gas station staff, electricians, plumbers, shelter staff, all of these folks can get vaccinated now, today. At the Wisconsin Center, at the South Shore Vaccination Clinic, the county site through your health department, there's lots of opportunities to get vaccinated. It's quick, it's easy, it's safe, and it's incredibly effective. And this is the key, it's the only way for us to get back to a sense of normalcy. The vaccine is certainly the way out of this pandemic, there's no doubt. In February, COVID-19 became the leading cause of death in the United States. More people died of COVID-19 than heart disease, than cancer, than strokes, than car crashes, than any other cause of death. Vaccines are our way out. We're seeing progress, and we will do our part to break down the barriers that make it more difficult for you to get vaccinated. And everyone else out there needs to do their part and get the shot. Just get it done, get protected, and help us to get back to normal. Thank you very much. Stay safe, and I will hand it to Director Rausch.
Thank you very much, Dr. Weston. It's my pleasure to join today to give a little bit more of a data update and what we're seeing in the COVID data. I'll start today by talking about a couple overarching issues, and they're very consistent with what you've heard from other speakers. We are continuing to see a stable and continued plateau in COVID-19 cases, and that's good news. But we need to remember that yet COVID cases are occurring, and we need to continue those mitigation strategies, the 3 W's, wearing a mask, watching your distance, and washing your hands, and really making sure you get vaccinated if you're eligible, encouraging people who are eligible to get vaccinated, and wait patiently for your own vaccination. The trend we're seeing in the entire population here in Milwaukee County of a continued plateau, we're also seeing in our school children, and that is very, very good news. So let me go ahead and share my screen, and we'll go ahead and look at some of the data and then allow time for question and answers. Again, since the data hasn't changed very much, I just want to hit some of the key figures and tables that we've talked about in the past. First up here today, just looking at the number of cases in Milwaukee County over the last year. And again, very stable over the last couple weeks, and that's a good sign. When we look at deaths countywide, we see that deaths have dropped off from a pretty significant peak that we saw back in November and December when our case numbers were quite high and the highest throughout the pandemic. Next, I want to take a look at the reproductive rate or the reproductive number. And again, last week I reported that we were above 1, which was concerning, meaning that we could have a potential for a spike in cases. Currently, our numbers are trending downward for transmission rate, indicating that we are starting to suppress the disease a little bit more. And you can see over the last year, there's been a lot of variability, but certainly the trend has been when that reproductive number or transmission rate approaches 1 and surpasses 1, we end up with spikes of cases. And we certainly want to do everything we can to suppress those cases. Next, let's take a look at testing. Certainly, testing is an important strategy in controlling COVID-19. And as we've reflected in the past, we have a lot of capacity for testing in Milwaukee County that we're not utilizing. So certainly, while the data is pending for the most recent week, and we've been stably looking at about 20,000 or so tests each week for the past 3 weeks, if you need a test, if you want to test, please access one of the testing sites throughout the community. Our trends are looking great. Our percent positivity is heading in the right direction. So there's a lot of really good things to be happy about and proud about when it comes to COVID cases in Milwaukee County. And as many other speakers have mentioned, it has been a year. March 6th was the first identification of symptoms. So this figure here shows where incidents or new cases, where hotspots existed over the past year. And certainly you can see that the areas that were red and orange are areas that we have targeted, and we had targeted with extra messaging, extra testing, extra outreach and education related to the COVID pandemic. And these hotspots existed throughout Milwaukee County, but certainly were centered in the south side of Milwaukee as we look collectively over the past year. But even that being said, there wasn't an area of the county that was spared by COVID-19. I'll just point out here, when we look at the cases per 100,000 on this figure, the top range is 136 cases per 1,000 folks. to 419 cases per 1,000 folks. That's a lot of disease in those particular areas of the county. When we look at this same figure over the last 2 weeks, we still see hotspots identified in red or orange, but the scale is different. You know, the top decile here is 1.6 to 9.3 per 1,000 folks. So while these reflect hotspots, they certainly are an order of magnitude different than what we've saw over the past year collectively. But we can't become complacent, and we need to continue those mitigation strategies that are so important. As Dr. Weston mentioned, kind of shifting away from the data, the big story today is really about the new eligible populations of Wisconsin residents who will become eligible to get vaccine within the next few weeks on March 29th. Just as a reminder of where we've been over the last several weeks, it has been challenging because as people become eligible, we haven't always had the vaccine we needed to appropriately get shots in arms. But I want to point out to everybody, much like Dr. Weston did, there are groups that are currently eligible and have been eligible for weeks or months that remain eligible. And even in my department here at the Greenfield Health Department, we still encounter a few people who didn't realize they were eligible or didn't know they were eligible. And these include people like frontline healthcare workers, residents of long-term care facilities, fire, police, adults over the age of 65. We've now, over the last several weeks, shifted to educators, child care workers, individuals in Medicaid programs, essential workers in grocery stores and manufacturing. I want to point out that these groups are eligible and will continue to be eligible even as we go forward after March 29th. Like you, public health leaders locally learned today about the next eligible groups. And these eligible groups will include those persons between the ages of 16 and 64 years of age with chronic conditions. The state website and the state press releases the Department of Health Services has put out identify several of those chronic conditions, but largely we're looking at chronic conditions like cancer, diabetes, heart disease, high blood pressure, and others. And there certainly are other conditions on that list. Overweight and obesity is also one of those chronic conditions on that list. So please, if you're a resident of Milwaukee County and you think you're eligible, take a look at that list, take a look at those conditions, talk to your physician, and seek out a vaccination when you are eligible. There are many local community vaccinators, including local health departments, pharmacies, medical clinics, and more. This next eligible group represents 60 to 65% of Wisconsin residents. And at the best estimates, the Department of Health Services believes that this is about 2 million persons in Wisconsin. With these newly eligible individuals, I continue to stress that eligibility does not equal availability. Allocations are slowly increasing in Wisconsin, and we're confident that more doses will be coming, but it's going to take time to get those doses into arms when we're looking at 60 to 65% of the population being in that next eligible group. As it relates to vaccine allocations in the suburban health departments for next week, most of us are receiving slight increases in our allocations, primarily because of the targeted doses of vaccine that are going to school and daycare personnel. So that's something that we're really working hard to complete over the next weeks. Some communities and some districts have completed their educators. Some will be completing their education and daycare staff soon, and still others will be completing that important eligible group within the next week or two. Our capacity in local health departments, as it likely exists for other community vaccinators, is still higher than the vaccine allocations that we're receiving, but certainly those allocations are starting to increase. Lastly, I would certainly be remiss if I didn't acknowledge the difficult reality that we have been existing in a COVID-19 pandemic for over a year. And it's been a tough year for you in the community. It's been a tough year for us on this media briefing. And we hear it in local public health too, because we're also living it. The past year professionally has been both rewarding, challenging, exhausting, all at different times and sometimes simultaneously. And I need to let you know that while local public health and healthcare systems have been planning for pandemics of communicable disease for years, nothing quite prepares you for the reality of a year-long or more than a year-long pandemic. But we have hope, and we have reason for hope. And that hope certainly is that the cases in Milwaukee County will continue to remain stable to decrease. We have hope that vaccination rates, which are climbing, continue to increase and more of our residents get vaccinated as they become eligible. And lastly, we have hope that a sense of normalcy may come soon after a year that was anything but normal. Thank you very much for your time, and I'll now turn it over to Catherine for the question and answer portion. Thank you.
Thank you, Director Rausch. Our first question comes from Sharon Bajenda with CBS 58, and perhaps it's for our health officials on the call. As we look back on the 1-year anniversary mark, how have vaccines changed our trajectory moving forward?
So I think with 17% of the county vaccinated right now, to be completely honest, I don't think that the vaccination rate that we've achieved or that the state has achieved has changed much for the COVID-19 trajectory as far as cases, hospitalizations, and deaths. We're certainly on the right track, but we know herd immunity is somewhere around 75, 80%. Certainly there'll be a dent in any future spikes as we get closer to herd immunity. But I think most would agree that 17% is not significantly changing trajectory of disease at this point.
Yeah, I would certainly agree with everything Dr. Weston said, and I'll echo this. Certainly we know from the spring that the COVID-19 pandemic was most deadly and most challenging in our long-term care facilities. And what I would love to believe, and what I would love to continue to believe as we see our deaths decrease pretty significantly in Milwaukee County, is that because our older, more vulnerable populations, not only those in long-term care, but those that are living within the community, because they're getting vaccinated at a very high rate, that we are going to start to see less deaths and less more significant complications. So as we think about those groups individually, we're getting closer to herd immunity. That's 75 to 80%. We're not quite there yet for our seniors, but certainly we're making a big dent and we're moving in the right direction. And I think certainly over the next several months, we will get there for the broader community.
Thank you both. Sharon's next question says, I've seen some epidemiologists say B117 now makes up 30 to 40% of cases in the US. What are your thoughts on that? And will it take off? Will it take off once it hits 50% of cases? Will we see another spike if vaccine rollout ramps up?
Yeah, it's an important question. B117 continues to grow in the country and certainly in our community as well. When we look at other countries, the UK and some European countries as well, we see that usually as it nears that 50% mark is when you have a change in trajectory of overall cases. You start increasing your overall cases. The rate at which that change occurs, whether that is an enormous spike or a very blunted spike, depends entirely on two things. It depends on the immunity in the community, specifically the vaccination rate in the community. The higher the vaccination rate, the more it blunts that spike, particularly among older populations like Director Rausch was talking about. And the other thing that it depends on is just the same individual precautions that we've been talking about for the last year: masking, physical distancing, avoiding groups. So those are the two measures that will slow what is to come. But I think without a doubt with B117, we will see some level of increase in cases.
Thank you, Dr. Weston. The next two questions come from Gabrielle Mays with Fox 6. She says, what decision-making went into allowing the Bucks to increase fan capacity at Pfizer Forum? And what do you think, or how do you think Milwaukee has handled the pandemic so far? And has COVID-19 better prepared the city for another possible pandemic?
Well, I can tell you that the Bucks worked very, very closely with our Milwaukee Health Department in putting together the plan that started out with very few fans. And right now, the changes that is occurring is allowing them to go from 10% capacity to 18% capacity. And so what you're seeing is a gradual incline here based essentially on the data that we've seen. The fact that they worked so closely with us and put together this plan is really what has allowed them to move forward. So we're very, very thankful for their cooperation and coordination in helping us get them to where they want to be.
Our next few questions come from Sari Lesk with the Milwaukee Business Journal. She gives some context to her questions. Given how many people are expected to become eligible later this month and the fairly wide array of conditions that will make people eligible, the state is encouraging vaccinators to prioritize people who are at high risk. Her questions are, how will vaccinators control for that when it's typically the vaccine recipient who selects an appointment? How should people who become eligible later this month consider when to schedule their appointment? Should they wait to leave time for people with some of the more concerning conditions to go first? And several outlets, for example, have written about the BMI metric and how it's not always a reliable indicator of someone's health or risk.
I can start on this. I think they're all great questions, and they're all questions that'll have much more detailed answers in the near future. I think the overall theme is we want to get as many people vaccinated as possible throughout Milwaukee County. We want to do that in an equitable way. We want to do that in a way that considers health risk, certainly, but we want to get people vaccinated. There's only so many barriers you can put up before it becomes difficult for people to get vaccinated. And so on some level, we need to trust people. We need to trust what they're telling us about their health conditions. But certainly the goal moving forward will be to get as many people vaccinated in as equitable a way as we can, as fast as we can.
I do see Siri has a follow-up question, and it's how will vaccinators verify if someone has one of the eligibility conditions?
Yeah, that's a very good question. It's certainly one that we're struggling with here at the health department, and other community vaccinators are as well. I want to expect and anticipate that many folks will do their due diligence and truthfully and honestly seek vaccine if they have one of those conditions. So that's where I want to start. If you're not eligible, please wait. Please let those people with conditions that put themselves at more increased risk go first. Many of us in local health departments and other community vaccinators are likely creating and keeping some sort of list. So as people come in, we can categorize them into the next appropriate eligible group. I know my staff will ask some basic questions about whether you have one of the chronic conditions on the list, and then we'll queue you up for a future call as vaccine becomes available later this month for clinics. And so certainly I want to hope that everybody is going to follow those rules and those guidelines and take your turn to get vaccinated. Remember, we all will get vaccine. And certainly we anticipate the state is going to open up more vaccine eligibility in May. So we just need to be patient and certainly allow those with more serious complications to queue up in line ahead of you, perhaps.
Thank you, Director Rausch. The next question is from Courtney Sisk with WISN 12. She says, when looking at C1 eligibility, it seems some additional essential workers are left out of the new state list. Will restaurant workers be eligible, and are they considered supply chain?
I think we continue to wait on more guidance from the state on the specific eligibility criteria.
And I'll just say, I would love to see restaurant workers included in this list. I think certainly right now they are interfacing a lot with the public, and they deserve to be on this list.
The next question is from Michael Spalding with WTMJ 620 Radio. For the mayor and health department, does the city or county provide any oversight to private businesses like Walgreens to ensure the people getting the vaccine fall under the current eligibility requirements? Are those private businesses policing those who show up for an appointment?
It's my understanding in the health department, maybe Darren can correct me if I'm wrong. Locally, we do not provide that verification. I simply don't know if the state does that or not, but the city of Milwaukee, is my understanding, does not.
No, that would be the same, Mayor, here. Everybody who's a community vaccinator should be using their best judgment to get people in.
The next question is from Drake Bentley with Milwaukee Journal-Sentinel. He says, 2 million seems low when estimating persons who are eligible. 70% of Wisconsinites are overweight. Are you prepared for the mass amounts of people that will be eligible?
I don't know the exact numbers of how many folks will be eligible with the recent news release. Certainly, we will work to expand our eligibility, particularly, I think, at the largest of the sites, the Wisconsin Center site, but also through all the health departments, all the health centers, the county site, many other partners as well.
Darren, you're on mute.
Just to dovetail on that, the numbers I shared came directly from Deputy Secretary of Department of Health and Health Services, Julie Willems Van Dyke. You know, a lot of people with obesity will have another condition. So those conditions aren't exactly mutually inclusive. They certainly are going to overlap. We don't have great numbers here, but this is a best estimate in order to provide the scope of this next phase. Certainly those numbers could be high, certainly those numbers can be low, but do remember that we have vaccinated some people in this population already, 16 to 64. Some of them might have already been vaccinated as 1A providers, police, fire, they might have been educators. So a certain percentage of them are done, but it's really hard to know that denominator or that total population because it's really hard to track all of those people.
Courtney Sisk with WISN 12 is asking which districts completed vaccinating educators and childcare workers and which ones are close?
Well, Milwaukee's still working on it, so we're not there yet, but our goal has always been to make the vaccines available to all educators by March 15th, and I think we're pretty close to that target.
Yeah, and I would say I can't call out any specific communities that are done or any specific school districts that are done vaccinating educators because certainly I think there's still a few stragglers left to come. But as I've said over the last couple weeks, the plan to vaccinate educators was done in conjunction with local health departments and health systems and pharmacies. So in some cases where there were a lot of community vaccinators with a lot of vaccine, they were able to more quickly get into some of the smaller districts in terms of staffing size and get those completed more quickly. I certainly can't say that I know how well the daycare staff and some of the after-school programs have been vaccinated to date. What I know is in Greenfield, and we're working closely with Hales Corners, we've got about 1,300 total vaccinators, and we're going to aggressively start the vaccination process next week now that we've received our allocation of vaccine. And we certainly will plan to wrap that up in the next couple weeks. And I think that's pretty consistent with many of the other communities as we've been planning throughout the county.
Our next question, I believe, is from Mayor Barrett, and it's from Chuck Kornbach with WUWM. Please talk more about the shelter vaccination program.
Sure. As I mentioned earlier, we've received notice from the state that we'll receive 2,000 doses of the Johnson & Johnson vaccine. This is significant because this is the vaccine, the first vaccine that only requires one shot. And as we talked about what would be the most efficient way to use this, one of the things that came to our attention was the challenges that we have sometimes with a transient population that sometimes resides in our shelters, various shelters, sometimes moves on someplace else. because it's a more transient population at times, it made sense for us to use the Johnson & Johnson and to reach out to the shelters. But we'll be using it in other contexts as well, potentially with some educators who don't come forth by the 15th. But again, our goal is to get the educators done, or at least have that vaccine available by the 15th. Our hope also is that the Johnson & Johnson one will increase in the amount that we get. And I think we're seeing this with all types of vaccines that will allow us to reach more and more people. But we felt that the shelters was a particularly vulnerable area where having one shot might be more efficient.
The final question I'm seeing in the chat is from Me Wisconsin, and it says, how many companies are considered essential, especially because they package and prepare food or pack meat? The Milwaukee Health Department has considered moving these companies to the priority list for vaccination.
So I can say these companies are state eligible. They are in food service and they're considered state eligible right now. So there's no question, anybody who works in any sort of food processing plant, a meat processing, dairy processing, vegetable processing, you are currently eligible. And there are many routes for you to get vaccine through, I believe through Wisconsin Center, through the other health departments, depending on where you live. So please seek out vaccine.
Thank you all. Those are the questions I'm seeing in today's chat. So thank you for joining. Have a good weekend, and we'll see you next week.
Thanks, everybody. Be safe.
Thanks, everyone.